When it comes to Medicare, you're not guaranteed to change every single plan every year, which is a really big misconception when it comes to Medicare. So in this video, I want to cover the one important plan to be aware of that you cannot change every year, but also what are the rules in case you do have a certain qualifying event where you could make a change to this plan. I'm Emily with the Medicare Coach, an independent fee-based consultant helping our clients easily navigate both the Medicare rules and insurance company options to help them do what's right and best for them to have the best health insurance, while also protecting their retirement savings. So I will share some extra resources down below to make your life easy, but I want to share with you again how these plans work and why you can't change this one important plan. Now, this one plan I'm referring to is called Medicare Supplement, also called Medigap plans. And this plan is important because it protects you financially. Medicare Part B usually covers 80% of your approved expenses. So these Medicare Supplement plans cover both the 20% that Medicare Part B does not cover, but also Medicare Part A copays. So when you first join Medicare, you are guaranteed to join a Medicare Supplement plan no matter what your pre-existing conditions are. So this 6-month window begins when your Medicare Part B, as in boy, begins. So when you first join Medicare, you have a 6-month window that you can do whatever you want, no matter whatever company, whatever plan, no matter what your pre-existing conditions are. However, once this 6-month window expires, in most states, you are not guaranteed to change companies, change letters, or even join a new plan unless you have certain qualifying events. Now, there are 5 main qualifying events that you could have which would allow you to change plans. Before I hop into this though, I want to be clear. You are not guaranteed to change your Medicare Supplement plan during Medicare's open enrollment period, which happens in the fall. I oftentimes hear agents tell people you can change it all the time. That's not the case for Medicare Supplement. Yes, there are some states like New York or Connecticut that have very relaxed rules, but in most other states, it is hard to change Medicare Supplement plans. So when you first join Medicare, you want to have that long-term perspective to get that right company as well as that right plan. So there are 5 things that can happen in which you are guaranteed to join a Medicare Supplement plan. Now, underneath these guarantee issuance rules, there's also specific rules on the specific letter that you can join. So you can't just join any letter. There are usually very specific rules as to which plan you can actually pick. So the first qualifying event is leaving an employer group health insurance plan. When that event happens, you can join a Medicare Supplement plan. Now, in most cases, our clients will also be joining Medicare Part B, as in boy, for the first time when they're leaving an employer group health plan. So if they have B if they begin B when they leave an employer health plan, they have more options. But if you already have B and you're just leaving an employer plan, you will have fewer options, but you'll still have a guarantee issuance to a Medicare Supplement plan. Okay. The second option to get a plan is leaving a Medigap plan or losing your Medicaid coverage. Okay, Medicaid has certain rules that look at your income. And as those change, if they ever kick you out of Medicaid, you do have guarantee issuance to a Medicare Supplement plan. While you're on Medicaid, you are not allowed to have a Medicare Supplement plan. So losing Medicaid would qualify you for a guarantee issuance window. There's also a rule called the trial rights. And this is that if you first join Medicare Advantage, when you initially join Medicare, you have a 12-month window to try out your Medicare Advantage plan. And if you don't like it within that 12 months, you can then go back to a Medicare Supplement plan. So again, a trial right is a third way to get additional options to join a Medicare Supplement plan, no matter your pre-existing conditions. The fourth one is moving out of a Medicare Advantage service area. We see this happen with Kaiser Permanente. Kaiser only takes Medicare Advantage. So if you're in, say, California, where they have Kaiser, and you move to, say, Arizona, where Kaiser's not there, you're going to have a guarantee issuance right as well for a Medicare Supplement plan. And the final one is if your Advantage plan is canceled. Just in 2024, many plans were canceled between 2024 and 2025. And so if you were in some ways lucky to be on a canceled plans, you got a guarantee issuance for a Medicare Supplement plan. So again, these are the 5 times that you were guaranteed to have a Medicare Supplement plan no matter your pre-existing conditions. Now, You can still try to apply for a Medicare Supplement plan, a new company, a new letter, or even just join one for the first time. But in most cases, they're going to ask you for your medical history. And if they don't like what they see, they're not required to accept you. So again, please be aware that one, it is so important to get Medicare right when you first join. And number two, there are some rules that allow you some wiggle room once you're on Medicare, so please be aware of those. But you're not guaranteed in most cases to change your Medicare Supplement plan every single year. If you found this helpful, give us a thumbs up. We look forward to helping you here at the Medicare Coach easily make your right Medicare decision and get the most out of your Medicare benefits.